weather. As obesity continues to rise across the country, often leading to significant health problems, many Americans are now turning to bariatric surgery. So Dr. James Wooldridge, a Oxnard bariatric surgeon, he joins us now with more information about surgical weight loss. So Dr. Gastric bypass surgery, not really the only surgical weight loss option out there. So what are some of the other options that we have?
Yeah, that's correct. The gastric bypass is still a mainstay of treatment involving a formation of a small pouch to help reduce the amount of food patients intake, and also creating a bypassing of the bowel to decrease the absorption of calories. But in addition to that, there's also the gastric band. A gastric band is a small band that's placed around the top of the stomach. This is an adjustable band, so it can be optimized to create a small pouch for optimal weight loss for the patient. There's another option, significant option that's a newer option. It's called the gastric sleeve. The gastric sleeve is a procedure in which we remove approximately 70 to 80% of the stomach, creating a thin tube. This is also a restrictive procedure that restricts the amount of calories that the patient can intake. These are both, in addition to the gastric bypass, options for weight loss surgery here at Oxnard.
So what are some of the set standards for maybe someone to qualify for surgery?
Yeah, so the standards are pretty straightforward. The first thing, patients have to meet certain physical requirements, and those include a measurement of a patient's height and weight, calculated out to what's called a BMI, or body mass index. And this body mass index has to be 35 or greater for patients with other medical conditions, or a BMI of 40 or greater without other medical conditions. In addition to this, it's also important that each patient undergoes an individual evaluation to determine whether or not the patient's other medical conditions are safe for surgery.
That's all right. Well, doctor, thank you so much for that information. And if you'd like more information on surgical weight loss, call this number, 504-842-4070, or go to www.oxnard.org.